But yeah, anyways, so all right, we're gonna post this on Instagram and just do a quick couple questions. We're trying to recap some of the things from our episode that was published on September 19th. It was a really fun episode for me because I am motivated to share my, people that work with me personally and people that I refer to professionally. And I just think it's probably really hard to find holistic care for dentistry and jaw and airway health, even though the jaw and the airway and the teeth affect the whole entire body. So I'll recap our, really we got 3 good questions. So we'll go, I'll go over the 2 that I think are really cool. And then if we have time, we'll hit that 3rd one.
Yeah.
So the first question came from a listener who listened to the whole episode, which included our chat about the thyroid and eating and maybe like foods that could be considered mouth care. And then we mentioned fish oil, and she wanted to know, how do you source fish oil? And what really, and then my follow-up question is like, why would a dentist care about fish oil for their patients?
Sure.
The second question is probably a little bit complex, but I think it would highlight like your specialty and encourage people to listen to the episode and maybe give you a call. And that is one of my friends who's a trainer. He's in his 30s, has a custom night guard. And I'm guessing it's for grinding. I didn't ask. But he said that when he wears it, it negatively affects his gums, so much so that they start receding when he wears it. And I just thought that was, really unfortunate, because I wouldn't know, where to even start with that. That sucks. So I wanted to help him, really, because he's
Sure.
a friend.
Yes.
So, all right. So which one do you want to dive into first?
We'll do the guard and then fish oil.
Okay.
What the guard question, first of all, we want to know why he's wearing the guard. What is the reason behind his dentist prescribing the guard? Because guards are basically a band-aid to a bigger problem. If somebody is clenching, grinding, cracking teeth, fracturing teeth, there is a bigger issue. So we want to find out if they have airway issue, if they have neuromuscular issue, what is it if they have parasites, if they have gut issues. We want to find those things out before giving out a guard. And then if a patient at the end of the day chooses to do a guard, then we want to make sure this guard is made out of material that is friendly to the body, like more biocompatible material. A lot of guards out market, like online, you can get guards, you can go to the store, pick up a guard. We don't know if these guards have BPA, BisGMA, bisphenol. A lot of them are made out of acrylic. If the patient has sensitivity to acrylic, then that material sensitivity can cause gum recession and irritate the gums. And also, how is the guard being taken care of? Is it very clean? Because, overnight, if the guard stays in, then different things can get built up on the guard. And sometimes my patients bring me the guards and I'm looking at them and I can't believe they're putting these guards in their mouth. And I'm like, please use something to really clean out that plaque. Because yes, we go in to the dentist and we get our teeth cleaned. How about our guards? The guards either need to be super clean to be used every night, so it's not adding another layer of bacteria to your mouth, or if it can't be cleaned, if it's to a degree that it has cracks and it has things building inside it. I have seen mold. I have seen all kinds of stuff on these guards. Yeah, they bring me like black guards. So you got to be careful. And they need to be replaced once in a while. But as far as is the guard sitting too close to the gums? Is the guard adding more issue to the whole problem? So those things need to be looked at.
Yeah. So, so there's a lot, there could be a few of those reasons why his gums would recede outside
Sure.
of, you know, that the underlying issue is not getting addressed. Outside of that, like, so yeah, so his gums become more unhealthy by the every day just by wearing the guard. So that's, yeah, so he really needs to get to the root cause. And I
Yes.
think he mentioned that in his message. He was like, well, in the next year, you know, I gotta, you know, drop some real investment on my mouth health. And I think so hopefully he's your next patient. Because so many of the night guard, what is it, like, why people get night guards are just to create less injury, like less fracture, and they
Yes.
just don't think about anything else. So we don't want to do that. Yeah.
And they're only wearing the guard at night. So if there is a bite issue, if there is an airway issue, if there's a muscular issue during the day, when they're swallowing, when they're chewing, when they're stressed and putting their teeth together, those heavy imbalanced forces are still working. So
Yeah. Oh yeah. Yeah, exactly. It's not, yeah, you don't have just imbalance at night. He did mention stress as well. And I know that's an issue with him. All right, Bowie, come on. Dog's like 80 pounds now. When you saw him, he was like,
I saw him.
30.
He was yeah, he was he has grown so much. Can't believe it.
Yeah.
The cutest.
Yeah, he's my little baby. Okay, so fish oil. Bowie takes fish oil and he has fish in his diet. So
That's
his
good.
coat's so shiny. Why did we mention fish oil in the episode? I forgot.
So in order to have healthy gums and teeth, we need healthy fats.
Oh, yes.
Especially like omega-3s and all that. So whenever a patient has a lot of cavities, we recommend cod liver oil, because what cod liver oil does, first of all, it's filled with vitamin A, and then also it assists in absorption of the other fat soluble vitamins like A, D, E, K, and vitamin D3 and K2 are major for our teeth, gum health, bone health. So that's why we want to have the fish oil. If they like to eat the fish skin, you know, it's like very oily and rich, great, do that. If not, then the ones I like to use, Metagenics makes a really good fish oil, as well as cod liver oil from Carlson. They have
that's available a lot of places. Yeah,
they can get it. And Genestra has a good fish oil as well.
Okay. Yeah.
And well, I can email you those.
Yeah.
And then if you want to put it under the comments.
Well, Metagenics is usually only available with physician stores. Yeah.
So most physicians that are like part of Metagenics or any of the, let's say, Full Script or other places, they have a link on their website. We have a link on our website under amenities, under nutritional health.
Oh, cool.
Patients can go and buy whatever supplements that are professional grade, that are only available through the physician. They can just go buy it. They will have access to it. Revelation Health also allows patients to just go online and have access to the professional grade supplementation.
Okay, fabulous. Okay, so we can definitely give people a resource there. All right, so do you want to now knock out this third question?
Sure.
I think it's a weird one. And you know, it's from a former patient of yours and one of my colleagues. So it makes, do you remember Angela?
Yes, I do remember. She's lovely.
So she's working with us now at the studio.
That's really good. Yeah.
Yeah.
I guess she's all the way in Maryland, so she's a little far. Yeah.
Yeah, but her and her son received holistic airway health, and you know, they're over the moon about it. So,
She
so
was very
she asked,
compliant and he got great results. We were
yep.
happy with the results. Yes.
Oh my gosh, he's so big now. He's so tall. He's all legs.
Yes.
He's in high school.
I need to catch up with her. I see her on the social media once in a while, and I need to message her, see how she's doing.
Yeah. Well, I'm so glad her and I are working together. She's such a blessing of a person. So she asked if there were stem cells in the ligaments of the teeth. And I can't remember. I think we were just talking about stem cells with one of our clients. It's such a hot topic in our office because we work with an orthopedic firm that does a lot of stem cell injections. I have some opinions about it for joints. It said that there's some in the mouth, in the teeth, all the way through adulthood. So I'd love to hear your take on that.
So, you know how we have the set of baby teeth and then we get the adult teeth. So if somebody was really interested in saving some stem cells, once they teeth can be harvested and just saved, there is a company there are different companies that actually freeze. When we send them the tooth and the solution, they freeze it and they actually extract that pulp nerve inside the tooth. That's where all the stem cells are. Whoa. So they extract that and they freeze it. And it's kind of like when a child is born, they give you the option of saving that umbilical cord for future stem cell and regenerative purposes. So it's basically the same idea, but it's like a lot in small. Then I guess patients pay a monthly saving fee to that company where this stem cell pulp cell is saved. It could be used for different regenerative therapy that you were talking about, and even cancer, like leukemia, multiple myeloma, and those things.
Yeah.
Yes. So people can harvest their baby teeth.
Yeah. Okay. That's awesome. And so they're not in every tooth root, nerve root.
They're in they are, especially in the baby teeth, because we don't want to remove a natural tooth early on and just in the purpose of having this tooth for future problems.
Care. Yeah. Yeah.
So you have baby teeth that you lose and adult teeth come right after them. So might as well, those baby teeth.
Oh, cool.
If somebody really wanted to save.
Does it make it possible for teeth to regenerate, like as in a cavity?
So interestingly, as you know, like every part of our body regenerates. But whatever it is with with enamel, if the decay is only halfway through enamel, and it's not all the way through enamel or through dentin, the decay can regenerate, like the cavity area, the tooth can remineralize, basically. But when it's too far gone, then the repair process doesn't happen for whatever reason. And when that bacteria and the bugs are into the nerve, then that's when we have problems. Because then there's no way back.
Okay.
All those regenerative cells or the stem cells, those growth cells are infected now.
Okay. Got it. Oh man. Well, that was great. I think we covered even more stuff than our that episode on on September 19th.
So I want to add something to that really quick, Jen.
Yeah.
Let's say somebody has like very deep decay but the nerve is not infected yet, but the decay is touching the nerve, right, in that area. But there is still some healthy nerve cells inside the pulp. And usually those patients are asymptomatic. They don't have pain and inflammation and all that. And if the patient is in good shape and they don't, their immune system is strong, then usually what can happen is with the use of laser and ozone, if you can clean that site really well and then use PRP, which is done to regenerate that site of tooth, and then do biomimetic restoration, which you put biocompatible material and layer the tooth, and also put a layer of medication right above the where you add the PRP material right on top of the nerve to help regenerate that section, then a lot of times you can save the tooth from a root canal, because root canal gives you a dead tooth. So
Yeah.
there is hope. They're always coming up with new things.
Yeah. I mean, that's even advanced from just a few years ago, it sounds like.
Yes.
That's really, yeah, that's cutting edge. But yeah, so that, I mean, I think that's just, even if that scares somebody just to hear, like, because it's like so unconventional, right? It's like cutting edge. That's okay, because like, you know, dentistry has to move forward.
Yeah.
Right. Like it has to. It's just like stuck. Like I can relate with orthopedic health. You know, the cut it, chop it, inject it with cortisol.
Right.
It's barbaric in a way, or replace it. My goodness. So I can relate on that level, and it really is, we deserve better options. We have more information. And so thank you for being that beacon of hope. And I'm finally coming out to the new office, and I can't wait to show off my gum. I think they're pretty healthy. I'm really happy.
Excited, yes.